How to manage injection site reactions from tirzepatide. If you're using tirzepatide for type 2 diabetes or chronic weight management, you might experience a reaction at your injection site. The good news, most of these reactions are mild and can be managed at home with simple approaches like cold compresses, over-the-counter hydrocortisone cream, and antihistamines if you're dealing with itching. But it's important to know what's normal and when to reach out to your healthcare professional. Injection site reactions happen in about 2 to 5% of people using tirzepatide. That might sound like a small number, but if you're one of those people, you want to know how to handle it. So what does a typical reaction look like? You might notice redness, some swelling, tenderness, or itching right where you gave yourself the injection. These are localized reactions, meaning they stay in that specific spot rather than spreading across your body. Most of the time, these symptoms are mild. They usually show up within hours after your injection and tend to resolve on their own within a few days. For most people, these reactions don't get in the way of continuing treatment. Now, what can you do if you notice a reaction? The first line approach is pretty straightforward. Cold compresses can help reduce swelling and discomfort. Try applying a cold pack wrapped in a thin towel to the area for 10 to 15 minutes, several times throughout the day. Over-the-counter hydrocortisone cream can help with redness and inflammation. Use it as directed on the label or ask your pharmacist if you're not sure. If itching is bothering you, oral antihistamines like cetirizine can provide relief. Just follow the package directions. Prevention is really where you want to focus because avoiding these reactions in the first place makes life easier. Proper injection technique can make a real difference. First, rotate your injection sites and avoid using the same spot repeatedly. Your medication guide will tell you which areas are appropriate for injection. Let your medication come to room temperature before injecting, following the instructions that came with your device. Taking it straight from the refrigerator can increase the chance of a reaction. Clean your skin with an alcohol swab and let it dry completely before injecting. Wet alcohol can sting and may contribute to irritation, and avoid injecting into skin that's already damaged, irritated, or has scars or moles. Here's when you need to contact your healthcare professional. If the redness starts spreading beyond the injection site, that's a sign to reach out. If you see pus or cloudy fluid coming from the site, that needs medical evaluation. If you develop a fever along with your injection site symptoms, call your doctor. Reactions that last beyond 5 to 7 days should be assessed. And if you experience signs of an allergic reaction like hives, widespread rash, difficulty breathing, or swelling of your face or throat, seek immediate medical attention. These are rare, but they require prompt treatment. Let me recap the key points. Injection site reactions with tirzepatide are usually mild and resolve within days. You can manage them with cold compresses, over-the-counter hydrocortisone cream, and antihistamines if needed. Prevent future reactions by rotating sites, following your device instructions for proper preparation and technique, and being mindful about where you inject. Remember, this information is educational and doesn't replace personalized medical advice. Always consult your healthcare professional about your specific situation and any concerns you have about your treatment. What's been your experience with injection site reactions? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.